All right, what do I have in my hand here? I printed out some Q&A questions from IWillHelpYourCat, and I'm late on some of these, and I apologize. Why am I late? Well, if any of you have read my book, 9 Lives, 1 Mission, this is to do with cats, CKD, how you really move them forward in a way that really matters. One of the things I write about in that book is I get quite personal. And why do I do that? I mean, I talk about some, amazing people and their pets that I help, that I'm involved in their lives. But I also talk about some pretty terrible people. Part of my purpose of writing about my experiences is to let you know that my life isn't perfect, and yet I'm still showing up. I'm still here for the people who need me. I'm still here for the pets who need me. And I want you to know that in your life, whatever is going on, whatever challenges that you have, that you can do it, right? And so I'm not coming from an ivory tower. I'm coming from in the trenches. I'm right here with you. So I do apologize for the lateness of these. I had to put out people, fires, and those people know who they are. Bad. All right, let's start with the first one. We've got Leanne. Leanne says, Grizu, age 16, is stage 4. Both his vets are amazed that he's doing so well clinically. Well, congratulations. So am I. That is fantastic. He receives daily sub-Q fluids of 100 mils. That sounds appropriate to me. Pre and probiotics and some supplements. I must soon move to France with him. Unfortunately, rabies vaccine is required to enter the country. He's never received that vaccine. How safe is it to have him vaccinate? Will it worsen the CKD? All right, so how many people want to move to France? I would like to go to France, at least vacation in France. I hear, of course, the food is going to be good. The sights are there to be seen. That's amazing. And now you're going down there with your amazing kitty cat. Let's break this down. So he's in stage 4. He's got some pre and probiotics and supplements. Why is this important? Read 9 Lives, 1 Mission. And what you're going to read down below is how these supplements and pre and probiotics absolutely help your cat by activating its gut-kidney axis. This is something that isn't talked about enough. It is something that can help stabilize your cat regardless of stage. And when I say regardless of stage, in some cases, stage becomes irrelevant in terms of what we're actually doing to increase their quality of life, okay? So she says, now what about this rabies vaccine? At 16, with stage 4, you're also going to be worried about, let's not rock the boat, right? If we don't have to take unnecessary risks, why would we? Why would we do that? So let me give you my opinion about that. In my hands, when I vaccinate a cat with specifically a rabies vaccine, they're okay. Let me tell you why. The first thing is usually it's not the first time I've seen them. I've got a good idea of how stable they are over time. 2, so when I'm giving a vaccine, which is a medical procedure that has its benefits and drawbacks that must be discussed, for me it's not just necessarily a routine thing, then I just have a good idea of how this pet may respond to something new anyways, including a vaccine or a vaccine reaction. 2, I use PureVax, and what that means is way back in the day, and I'm talking 2003, 4, 5, vaccines for cats were different. The adjuvant, which is the part of the vaccine that sort of activates it, it makes it a bit more effective, but it was a big part of why there were such things as vaccine reactions. It was a thing of why there was recommendations at that point in time to give vaccines on cats and this is going to sound ridiculous, right? But I actually saw it happen. The recommendation was to give cats vaccines in their extremities. This is kind of like their lower limbs. This is like kind of even near their paws. I've seen some people give, and you can imagine, I never did it, right? The vaccines got better, but it was a great way to ruin your relationship with a cat. You're actually poking them with a needle in a very sensitive area that they hate. They hate to be touched that way in those locations. Anyways, the whole idea back then is you could give a vaccine and you had to assume that there's a certain percentage of cats who are going to have a reaction, and that reaction could have created a tumor, and that tumor required an amputation. Isn't that brutal? Yes, it is. Here's the thing. Since 2003, 4, 5, 6, and then maybe even into 7, there's a whole new generation of cat vaccines, and especially when it comes to rabies, I use a type called PureVax. So the adjuvant is different, the vaccine is different. It's so much better because I've done literally thousands upon thousands of vaccinations for cats, especially if they're traveling, and I have yet to see a vaccine reaction. It's actually one of the least reactions I see in modern times. So I'm not one of those vets who are going to give a vaccine for a cat in some horrible area to cause extra pain or issues behaviorally with them, because the thought process is I might have to do an amputation. It's bizarre, it's weird, but it happened at a point in time. All to say, in my hands should be okay. In your vet's hands, probably okay. You want to just check that we have a good PureVax vaccine. Typically, it's you might find terms like thermosol free. You just might, if you look into it, if you talk to your vet about it, and I've had clients talk to me about it, and we've ensured that the vaccines are the most modern, less reactive. You should not create any issues with advancing CKD. How do I know that? It's because I have many cats, patients of mine with CKD, and I test their blood routinely. And there's no difference with me in terms of cats who are vaccinated versus cats who are not vaccinated in terms of CKD progression. In terms of my patient group, I have not made those correlations at all. All right, let's move on. Next question. Nico, you got the wrong page. All right. All right, Nico, I've had you waiting for a while. I apologize. And Nico's got 3 questions here. Here we're gonna do it. What's your opinion on the new supplement that recently came out, Porus One? Okay, you're so glad you're talking about Porus One. Porus One is something that you're gonna hear from people that's like me, who are advocating or treating cats using the gut-kidney axis as a part of their treatment regimen. And what's even the whole point of that? Well, for me, it's not. CKD is much more than a staging thing. I like to go to the core root of the problem, which is fibrosis. And when we're getting into fibrosis, these are factors that affect the progression of CKD in the kidney. So I'm less thinking about stages. I'm more thinking about what can I do for this individual right now, regardless of stage, that's going to get to that core problem. Not just taking care of symptoms, but also taking care of the primary drivers of fibrosis in a cat. And so how does Porus One fit into that? Well, there is this thing called the gut-kidney axis, and what that means is that there are toxins within the gut that can build up, that recirculate back into the circulation in the bloodstream, and then eventually go affect the kidney in a way where it increases fibrosis. Fibrosis is scar tissue within the kidney structure, which is advancing CKD. And so the whole idea is we're kind of using the gut as a secondary kidney. We're using it to enhance kidney function. We're using it to get rid of certain toxins that are uremic in nature. They're essentially going to build up in that bloodstream. They're supposed to go out in the urine, but there's a problem with the body doing that. So Porus One, why do I like it? Well, for me, it's either Porus One or pre and probiotics. I'm either using one or the other or both in a way to get this gut-kidney axis going. This is all part of what I talk about in the BITE strategy, which you get in my book, 9 Lives, 1 Mission. And so what's the advantage of Porus One? Well, the advantage of it is that I think it's the quantity, actually. If you compare a pre and probiotic and you compare the quantity of that to Porus One it's very small, it's very concentrated. So if you've got a cat and maybe there's a palatability issue, you can't change the food too much, maybe Porus One is the one to try. At the same time, with a lot of the pre and probiotics, they're not formulated, so they're bad tasting, and there's some cats who actually enjoy it, they like it. And because of that, because of that, you're going to either try out one or the other, or maybe a combination of both. They each have their own place, they each have their own role. In terms of Porus One, it's an absorbent. It's going to go into the gut and take out those toxins that we don't want to go back into the bloodstream. That's going to affect the kidney, which affects kidney fibrosis, which equals advancing CKD. And then your cat doesn't feel good, and then they don't eat as much, and then they don't gain as much weight, and it's a vicious cycle. And there's all these cycles in your cat that we don't want to progress. We want to slow those things down. So Porus One, I'm a fan of it. I actually talk about it in my CKD master class. It is something that can be used. All right, thank you. Nico's got another question here because I've been so delinquent with getting back here to questions. Would antifibrotic supplements like nattokinase and probiotics help mitigate CKD in cats? Well, that's a great question. And you know what? I I had not heard about nattokinase, so I did look it up. It's an enzyme extracted from natto, a Japanese fermented soybean food made with bacillus variant of natto. It is marketed as a supplement because it can have fibrinolytic activity, meaning it may help break down fibrin, one of the proteins involved in blood clots. That is why people often describe it loosely as a natural blood thinner or anti-thrombotic agent to help manage human cardiovascular disease. So let's talk about that. So glad you brought this up, because we are talking about kidney fibrosis, which is essentially CKD. We just don't call it that way. I mean, when's the last time your vet called your cat's CKD a problem of fibrosis? It's just not a typical term, but I use it because it really gets down to your job, what we have to do to be successful with them. And so I haven't found anything in the literature in terms of it being effective for this role, because it more seems to work in terms of what's going on with blood clots in the body versus the mechanisms of fibrosis within the kidney. And essentially, because it can affect clotting, potentially there are some contraindications with other medications that you could be using for your cat. So I would personally be careful of that one yet. But if I just look at the core of it and what it's for, at least in people, that one probably not going to be using yet. Since excessive aluminum appears to have a detrimental effect on human cardiovascular and renal functions, is it safe to use aluminum hydroxide, which is known as Phosbind, for cats? Great question. All right, let's talk about Phosbind and aluminum. Why would this play a role with your CKD cat? How do you know if this is for your cat? It is if your cat has something called hyperphosphatemia. If you don't know that term yet, again, it's in my book. You can look at it. It sounds like a complex term, but it's not. It's just a single line in your cat's blood work, which you should know, actually. And if it's not being talked about, then it may be because your cat is on the higher limits of what is considered normal. But let me tell you, when it comes to fibrosis in a cat kidney, it's one of those things where we can tweak it a little bit and lower it, even though it's on the higher range of normal, and we can get it back where we want it to be, which is, for me, on the lower end of normal. There may be benefits with slowing down CKD progression in your cats. So for a lot of cats, this could lead to some diet changes, but for other cats, you're modding the food. You're adding in a supplement to the food. Phosbind is like a supplement for the food. It's not a drug or something your cat's going to absorb into their body and affect something in their physiology. It's actually more like a food additive. So it's going into the diet and it's going to bind phosphorus. Phosphorus is in the food, and what's going to happen there is that it won't be absorbed by your cat, and then it goes too high in the bloodstream in your cat, and then it creates a problem downstream with the kidneys. Instead, it stays sequestered in the gut, and then it goes out when they poop. So the question is, well, it's actually got some aluminum content in there, so is it going to damage my cat? Here's the good news. Again, almost like the first question we had with vaccines, I had the benefit of seeing thousands of different cats in all different conditions with different problems and using Phosbind in them. And so could you theoretically run into a aluminum or Phosbind adverse response? Technically, yes. I haven't seen it yet. Here's the number one thing to watch for. If you're using excessive amounts of it, the first thing that could potentially happen is a higher incidence of constipation. Now, CKD cats can be prone to constipation anyways, and so it's one of those things where my clients are looking out for that. But if I'm jacking up this level, I'm probably going to see better effects in the cat's body, and therefore better hydration, and therefore I'm less likely to see any constipation. Now, what if you really went on the loose with this powder in your cat's food? Is there a potential for an aluminum issue? Well, it tends to be, it's like this anemia that you could potentially see with them. Have I seen anemia with CKD cats? All the time. Have I seen anemia develop after giving Phosbind on normal levels? No, I haven't. So I think you've got to really have either a quite sensitive cat, or we're really blasting those levels. And at that point, you know, we're probably just not going to do that. We're probably just going to switch diets. Would be a case for a prescription diet, and then we're going to supplement on top of that, versus take a high phosphorus food, try to put a lot of Phosbind in there to manage that, and if we're not successful, just add more. I think maybe if we're going to get in trouble, that's where you can run into trouble. So great question. I haven't seen any aluminum problems. What it would look like is I could probably see it on the blood work, but usually our strategies are going to be not to get there in the first place using excessive amounts. Got another question here from Pam. My 17-and-a-half-year-old cat has had a growth on her leg from which she has scratched it open many times and is irritating it. Now it's now at a point where it's almost the size of $50. Wanting to proceed with surgical removal, but she has a heart murmur. Would you do surgery without an echocardiogram and chance it? She's very healthy otherwise. Her BMP is 319. Vet said he would use anesthetic cautiously and feels she would do okay, but I know it's always a risk. All right, let's talk about that. Absolutely, when you go through, if there's, and I agree, if she's constantly irritating this lump, let's break it down right there. Do we remove a lump or not? If it's benign, meaning that it's mischief, but it's locally mischief, often, and it's not affecting the rest of the body, I'm often just going to leave these lumps be. But if it starts to become a quality of life issue, so the cat's irritated at it, it's getting infected, he or she's bugging it all the time, it's just going to get bigger, resulting in even more invasive surgery down the line, then yes, I'm going to consider removing those lumps. That's going to beget anesthesia. Do we do anesthesia for cats with CKD and or heart murmurs? Yes, we do that all the time. Do we have to do an ECG? No, we don't. Okay, I'll tell you when I'm going to do an ECG. It is when I hear a gallop rhythm. So if your cat has and you didn't mention that, so it's probably not there. A gallop rhythm for me is a bit more trouble. When that rhythm is very abnormal that way, I do want to know more about the heart, potentially before going to a surgery. A murmur in and of itself does not mean heart disease that is going to affect your cat. If I just go back to my first cat named Zach, he had a heart murmur, and I think it was diagnosed when he was 11, 12, potentially even 9, and he was 22 when we parted ways, right? So that heart, and he had gone under anesthetic before. He actually had a lump to be removed with his heart murmur and his CKD and his hyperthyroidism, and he did fine. Now, was I nervous about it? Well, of course. Of course you're going to be, you love them, so of course you're going to be worried about it. Is it something that the cardio BNP, if that came in on the lower end, if not normal, and so a 319 is considered, now it depends on the lab blood work ranges of where you live, but here it would be considered on the lower end or within the normal range, and so that means the heart muscle isn't all stretched and stressed. Therefore, we have great information to suggest that a proper anesthetic for your cat could give you good results. You could remove this lump and think that, yeah, you've covered your bases. Sometimes doing the ECG is a good idea. I did it initially for Zach. It is true. I would say sometimes it doesn't change your plan. The ECG might give you information to say, hey, anesthetic specialist, just do the anesthetic this way, but we're still going to do it anyways, right? So I'm not going to say don't do the ECG. I'm going to say that if I just had to base this surgery based on the information you provided me, which is your cat's otherwise doing great, 1, 2, there's no rhythmic abnormality, so there's no gallop rhythm, 3, we're not open mouth breathing. We're not having respirations above 30 per minute. We don't look stressed all the time because every time we move our bodies, we're quickly running out of breath because of a heart issue. If that's not going on, rhythmic abnormality going on, the murmur is noted, but your vet's like, okay, this is like the garden variety murmur, then that's one of those things that life goes on. It may be one of those things, you remove this lump on your cat is less stressed. And then the last thing, especially if your cat's got CKD, you always make sure you do the things to wall off from heart stress. And this typically means you monitor for anemia and you make sure the thyroid and blood pressure are okay. So you're gonna take away the things that can stress out that heart over time, so your cat's heart gets to last a lifetime. Okay, hope that helped. Looking forward to our next Q&A. Take care.